Over 20% of Americans are reportedly living with chronic pain that lowers their quality of life. And for most, the only options available are steroids, painkillers, or surgery. Our guest today has developed extensive protocols and workshops to help treat chronic pain and inflammation by targeting the lymphatic and vascular systems. He's a chiropractic physician and master fitness trainer with over 25 years of experience in the health industry. This is the story of Stop Chasing Pain with Dr. Perry Nickelston. Dr. Perry, so nice of you to join us. How are you doing today?
I'm doing wonderful. Thank you so much for having me on the show. Truly grateful, blessed, and honored to be here. Thank you.
Well, very, very grateful to have you. And as a starting point, I always like to go to the stories of the guests themselves that led them to what they're doing today and the great work you're doing. And I understand you healed from a severe back injury, autoimmune disease. Can you talk us through what even led you into that, being a doctor, and kind of the story that leads you up into today?
Yeah, I'd be happy to. Well, it may be a journey that's similar to others that get into healthcare field from your own pain and suffering from yourself. But honestly, it can be from the pain and suffering of a loved one in your life where you feel powerless at times to be able to help them. And then that's the catalyst that pushes you into something, right? And that's the way it was for me. Initially, I got into chiropractic medicine. I graduated from chiropractic college in 1997. And my original journey for that was for unrelenting back pain that just was not going away over and over and over. And then it helped me stand up again. And I said, this is pretty amazing. I would like to do this for other people, right? And then along that journey, I just grew and expanded as a person, as a human being, as a practitioner. And then later on in life, I developed other types of complications and issues, some autoimmune disorders, some inflammation. And people always ask me, well, what was your diagnosis? What was it? I didn't really have a diagnosis. It felt like I had everything, honestly. And that was a really big learning experience for me because I was trying everything that I've learned up to that point to heal myself with what was coming at me, but it wasn't working. So automatically I knew I needed to think differently. My concepts had to completely change. And the people that I was seeking help from, they weren't helping me either, right? And then I thought, well, then I have to look at it differently than what they're looking at it. And that's what led me on to the journey that I teach a lot now in relationship to the lymphatic system of the body, because that's one of the biggest things that I began to do that that flipped the switch for everything, honestly. So it was just one level of pain or suffering after another that instilled the need for me to change. And that actually helped form my definition of what pain means for myself. And pain very often means suffering for people, right? But pain is always a protective response. Your body's trying to protect you from something that can be far worse than where it is now. But pain is a request for change. That's the way I look at it now. And a request from whom or what? Well, your body, and then to change what? Well, the easy answer is yes. I don't know what it is. I just know it needs to be different than what you've been doing up to this point, because obviously that's not working. And sometimes it's just a matter of changing your definition of what pain means. Like, honestly, if you can change the definition from punishment to protection, that makes a big difference on your healing journey.
Right. And that's the unique thing, I think, about a lot of what conventional medicine does. Sees symptoms as bad things. And like you said, tries to put a diagnosis on you based off those symptoms and treat that. And it's really not a treatment. It's more of a managing or a suppression. We use painkillers to suppress the pain. Is it gone? No, it's just suppressed in a sense. And that idea that we require a diagnosis to do that, as you said, is a little bit of a fallacy. I remember writing once an article I published called "The Death of the Diagnosis." And it pissed
Mm.
off a lot of doctors because they said, without a
Right.
diagnosis, you can't do anything, right?
Mm.
Whereas the diagnosis, as you know, is just a description. Most people go into a set protocol for the diagnosis that's not take into their unique factors or not take into the idea of why the pain is even there. The why is not non-factor. It's the what. It's a diagnosis, and you take these drugs. And if you don't get better, we go on and go on. And it is a whole new game that you're talking about when you start to understand and change definitions, such as pain is not punishment, it's protection. And then you have to ask, what is it protecting you from?
Mhm.
So in many cases, I think there's always unique ways you could look at what it may be protecting you from or signaling to you that you require change. But what are some of the common patterns? Because everyone's going to have a unique set that leads them into the pain. What are some of the common patterns that you're seeing?
Yeah, so that's great. I mean, it's a great point that you made there, and it's that pain is contextual first, which means that it means something different for everyone. Because what could be painful for you is not painful for me. So pain in and of itself is always subjective, not objective. There's no way that you can quantify that. We try to with where does this sit on a scale of 1 to 10?
Right.
But my 2 could be your 10 based on my prior experience with pain. Maybe I'm a Navy SEAL and I can deal with a lot of stuff and you're not. That makes a big difference on your outcome, right? But then it's also important to realize that pain only tells you that you have an issue or a problem. It doesn't tell you what it is or where it is. And that's where the stop chasing pain model came from. And I tell people, notice it doesn't say stop treating pain. It means don't chase it. And what I mean by that is that you look wherever somebody points. My shoulder hurts here, my hip hurts here, my knee hurts there, right? And then first of all, I'm going to ask, why are so many places hurting at one time, right? But it's logical to start there, right? Because maybe a zebra is a zebra, but sometimes a zebra is an elephant, which means it's not that. But if you treat where it hurts and it gets better, well, that's awesome. That's great. That's what you wanted to happen. But very often, it has a tendency to do this thing, which is called coming back over and over and over again. Then you have to figure, okay, well, I'm overlooking something here. Right? And then I just started to look, you know what? Well, let me just look everywhere else. And then maybe I'm going to find an area that you're not looking at that's not painful on you, but is contributing to that area of pain. So say, for instance, it was your right shoulder that hurts. I'm like, well, maybe it's your neck that's contributing to that. And I'm going to tell you right now what it is. It's always going to be a factor in that. Or maybe it's the opposite side hip. And it has to be from there as well in some way, shape, or form, because every time you walk, you have to swing your opposite side hip with your opposite side shoulder. They go as a pair. Does that make sense? So it was just the aha moment was, let me start where it hurts, and then let me start to look everywhere else. But I was still trapped in a musculoskeletal kind of paradigm, which means that if my shoulder joint hurts, I'm going to look at the joint, I'm going to look at the muscle, I'm going to look at the fascia, all those fancy words that just mean different types of body tissue. But I realized there's a lot of other different systems of the body that can be contributing to that. One is your emotional system and your psychological system, because many people are under so much chronic stress and duress and emotional turmoil and trauma that's causing the inflammation that they're dealing with and the pain. So in my viewpoint now, there's always an emotional component to pain. That's why you're not a rock. You're a human being. So you have to take that into the perspective, Also, like I said before, your story about your prior pain makes a difference on your current pain. But then I started to look at, well, holy cow, there's a lot of other different systems in the body that I'm not paying attention to, like my immune system or my organ systems or my cardiovascular and blood flow systems and lymphatic systems. And that's where I actually found the biggest piece of my missing puzzle, is that I was just isolating things too much. That's my biggest thing that I try to change people in, is to expand and look at the body as one single functional unit, because it's not parts, even though that's the way we look at it. And it's okay if you look at parts, and we have to put a kind of a context to how you get your pain. So what I mean by that is this: traumatic onset pain is usually easier to get a handle on, because you have, okay, A happens where I get hit in the shoulder with a bat. Now I know why my shoulder hurts. So I'm going to look at my shoulder and I'm going to treat the trauma to the shoulder, which nobody does better than traditional medicine, right? But it's that chronic pain that comes on afterwards, or it's the person who didn't have shoulder pain yesterday and today they wake up with shoulder pain.
Yeah.
You have to treat that pain completely different than you did the one that got hit with the bat. Right? You can start initially the same, which is treating where it hurts. And just doing that makes somebody feel better, because you're showing empathy and understanding that I see what you're telling me and I'm going to validate where your pain is. But I know without a doubt there's going to be a contributing factor somewhere else. And that's what we have to look for. All right. So my journey for Stop Chasing Pain honestly was quite easy. When somebody comes in to see me and they point to an area that hurts, I know they've typically had everything that you can think of done to that region, all the x-rays, all the MRIs, all the tests and everything, every type of treatment you can think of. I just do the exact opposite. I don't do any of that, because if you needed that, you wouldn't be standing in front of me asking me for help. So I'll be honest with you. I don't think that people see me for treatments now. What they see me for is the way I think. How I look at the body. Because if you can figure that out, well, then you'll find the right treatment. You follow?
Yeah.
Because if you're treating the wrong spot, I don't care what you do.
Right. And that's the thing. And we see it a lot at our clinic as well, that is integrative, bioenergetic, all these, we see it as body, mind, spirit. And most people that come in, we're their last resort in a sense. You went to every specialist out there. You've had all the functional lab tests, even everything. And then, you come to us and it's, well, are you going to run the same labs? It's like, well, you've been doing that for how many years now? And how's that worked out? Why would we just do the same thing and expect a different outcome? We think differently. We're looking at root causes. You saw downstream effects. We're looking at upstream effects. We can match the two and show you how that works. But we're not just going to keep casting the line where it's never picked up any fish before. So it is a change, but people are, creatures of habit. So they want the same thing done and done, but they're going to usually get the same results. Now, you mentioned something there that, some people do get the bat to the shoulder. They know why they have the pain. They may not know why it turns chronic, but they know that there was an injury, acute injury, something happened there, sometimes sports related or physical related. But are you seeing more and more people? Because I would think more and more people are less and less active in some ways, but there's still so much pain out there, meaning the person that just wakes up with the neck pain, that has the chronic back pain, but never actually lifted weights or did anything or was in an accident before. Is that becoming more common in your practice?
Oh, absolutely. And I think everybody would agree with that who's in the healthcare field. That's why we're having an explosion in chronic disease, chronic pain. Those are the more difficult ones to get a handle on, because, like I said before, medicine is very good at finding, one culprit, one cause, bat to the shoulder. Well, there you go. Or they're looking for something that might be, a bacteria or infectious agent that, okay, that's it. I know exactly what to give you. We're going to take it out. But when you're dealing with chronic pain and chronic disease, the dirty little secret is it's never one thing.
Yeah.
It's a culmination of, it could be 10, 20, 30, but also the culmination of your entire life from the moment that you were born. That's why it's it's a slippery slope when you start to treat a diagnosis, because one, the patient can become the diagnosis label that you gave them. And that becomes their quicksand sinkhole that they never get out of.
Mm-hmm.
And then two, you treat all the people the same way most often. Well, here's the protocol that you do for XYZ. Here's the protocol for like a leaky gut, for instance. Or say, well, yeah, everybody's body parts are different, right? Because a different person is carrying them around. They're going to respond. They're not going to respond the same way to the program. So that's why people say, I did this, and it didn't work. Well, that's where you have to go more of the individualized medicine. And the way that you practice individualized medicine is, I have a novel idea. How about you talk to the individual in front of you? And you go through their history and you do a really great hands-on manual assessment, which is one of the biggest missing components in medicine today, is that we test, and we never talk and we never touch, and you will never find things on a test that you can find when I talk to you, and even more so when I get my hands on the body. So there's a art and a science to medicine, and that art has to come from getting your fingers in the paint, you understand? Yeah. And laying down some canvas. Because for instance, I have people that say, okay, well, I don't have any issue here because nothing showed up on, let's say, your abdomen, right? First of all, they're going to say, why are you looking at my abdomen and my shoulder hurts? I'm like, well, because it sits in the middle of your shoulders and your hips. That's why. And they said, I didn't see any problem there. There's no issue because I don't have any symptoms, right? But then you get them down on a table and you just place your hands lightly on the abdomen, and you can actually visibly see a person's nervous system go into a fight or flight response that shows that the system is getting very anxious because you're getting close to something. And then when you push in just with a little bit of pressure, they go, ow. And then my point is, it's not supposed to be an ow when I press into your abdomen. And I'm going to contend till the day I die that ow is going to be one of the contributing factors to the pain you keep pointing to. But nobody knew it was there because nobody took the time to stick their fingers there to find out. Right. And then that's how you find inflammation. Because in my world, chronic disease is inflammation. And then inflammation is going to cause pain somewhere. It doesn't mean, this is where you got to hang on for, it doesn't mean that the pain is necessarily where the inflammation is, or you're allowed to have more than one side of inflammation and you're allowed to have more than one problem. And then you have to, so what I look for are all the areas of inflammation and pain that you don't know about that you haven't been pointing to. Yeah. And if I go after those, very often you start to feel a little bit better in what you're doing.
Yeah. And most people, I believe, think that inflammation is due to some injury, infection, something that is, a physical thing, whereas we understand that it could go much deeper. Inflammation could be caused by toxicity. It could be caused by emotional trauma. It could be caused by many, many different things. Even nutritional deficiencies can lead into that as well. But, a big part of what you talk about is something that we love to talk about as well, just in disease overall, is lymphatic drainage. Is this, overlooked side, I think, of everything that is detox and organs of elimination. Everyone knows the liver. When you drink, the liver gets impacted, and your kidneys because you're excreting things, your GI in some ways because, of course, you're excreting. But, that unsung hero is the lymphatic system. And a big part of what you do with Stop Chasing Pain is look at the lymphatic system and lymphatic drainage. What led you to that realization? Meaning you went past the biochemical kind of physical look of pain and you started looking at many different systems. It's all intertwined. It's all together. But what was it that brought you to the lymphatic system?
Almost dying and wanting to kill myself. And I'm not kidding you. I reached a form of rock bottom where I was in the abyss. I was below the abyss where I just couldn't get out. And I needed to find a different way of looking at my body and looking at the healing, and then really stopping and asking, okay, what in the world is my body trying to tell me here with what's going on, right? And a big part of that was inflammation, right? And I think before I get into my story, it's really important for people to understand that you need inflammation. Like if you didn't have inflammation, you would die way sooner. Trust me, because that kills stuff that's trying to kill you. But unfortunately, sometimes that inflammation switch turns on and it doesn't get turned off or turned down. Mm. And then everything becomes an inflamed hot mess because inflammation is an immune system response, not a musculoskeletal one. So that's a big one that people need to understand. So when you get a boo-boo or your knee hurts, it's not musculoskeletal inflammation. That's immune system. So that was a big one for me of like, oh, I've been looking at the musculoskeletal system and I've been looking at the nervous system. Let me look a little bit more at the immune system. And then you realize, holy cow, they all talk to each other. Right?
Yeah.
And so I said, I've got all this inflammation in the body. So why is my body having a hard time getting rid of it? And why is it going and overproducing the inflammation? First of all, the answer is protection. Right? And then I said, okay, well, what's part of inflammation? Well, the lymphatic system, its main job is to get rid of inflammation in the body and things that are trying to kill you. But I never looked at the lymphatic system in my journey up to that point because I didn't think, well, I don't have cancer. Why do I need to look at the lymphatic system? Because that's usually when you'll hear about the lymph system, because cancer can spread through the lymphatic system, and people have had lymph nodes removed, especially when they've had breast cancer. That's a big part of what they do. But you also need to, when you learn that the lymphatic system kills cancer cells every day, so you don't get cancer. That's a big part of its job, right? And then I don't have lymphedema, and lymphedema is where you have a problem with your lymphatic system where it doesn't work as well or is compromised. And then body parts become abnormally swollen compared to another one where you have a leg that really swells up. But I didn't have any of those. So I'm like, I don't have a lymph problem, right? Unbeknownst to me, I mean, that was one of the biggest things that I was dealing with, but I didn't realize it at the time until I went back to basics of, okay, let me just try to understand inflammation and the lymphatic system. And I was starting to study, let me go back to fundamentals of what cells need in order to heal, recover, and generate. I said, I'm going to wipe the slate clean, forget all this muck that's been instilled in my brain from education, and start from Sesame Street level. Okay, like C-spot run. I have a cell here. If I can figure out how one cell works, I could probably figure out how the other trillion work because it's the same basic mechanism. And I said, okay, well, cells need nutrients and oxygen, a lot of it, right? So you get that through breathing and you get that through food that you eat. I'm like, okay, well, once you have the food and once you have the oxygen, how does it get to the cell? Well, that's blood flow, right? So blood flow is a huge thing for me because if stuff doesn't get to the cell, you're not getting better. Hard stop, period. That's it. And then, okay, if it gets to the cell because I get good blood flow, the cell uses the nutrients and the oxygen, and that creates energy so it can heal itself or it can make new, more resilient, stronger cells that adapt to the stress of life. So you become more of a #beast mode monster human being. Right? But when you make energy, what do? You make waste. Right? And then how does the waste get out of your body was the next question. Well, it gets out through the bloodstream again, just a different part of it, through the veins. So blood flow once again. But then it's the lymphatic system. The lymphatic system is the primary system that gets rid of waste in the body, and it kills a lot of the stuff that gets into the body that's trying to kill you. It kills viruses, bacteria, parasites, toxins, cancer cells, and you pretty much name it, right? And its main job is to get rid of excess proteins in the body because you don't want proteins floating around in the body because that's going to make you an inflamed hot mess. and it's going to get rid of metabolic cellular waste, which is basically cell poop, and long chain fatty acids. Gets rid of those. And so that's getting that toxic stuff out. So it takes it out. Here's kind of cool. It takes it out and puts it into the vascular system, into the veins. So then it can go out into the other arteries again. So it can go to your liver, it can go to your lungs, so it can go to your colon. So you can breathe it out, you can sweat it out, you can pee it out, you can poop it out. So all these things, I realize that most of your organs are designed to get rid of muck, what I call muck, waste. I said, oh my goodness, what would happen if something happened to the waste management system of your body and it was compromised and couldn't get out? If it can't get out, you're going to die within 2 days, period. But what if it is maybe working at only 50% capacity? You might not feel it right away, but you'll feel it after 5, 10 years, right? Because it hits an overload and overburden. And then why are you going to get inflammation? Well, because you're living in your own toxicity of waste, right? And then if they can't get out, then your body's going to say, that stuff's not supposed to be here. We got to kill it. And what's the number one way it tries to kill it? It starts with IN and ends with inflammation, right? So then you become inflamed because you can't get rid of things. And it's just this vicious cycle that happens. And I realized for me and for most people, I was busy trying to put all the nutrients in and the oxygen in, and that's the diet, that's the breathing exercises, all the stuff on the front end. But if you don't clear the back end first, you're gonna make yourself worse. You're not gonna get better. Because I realized that, hey, even good food also turns into waste.
Yep.
Just like bad food. I mean, I'd rather eat good food than bad food. That's a good step up the ladder of healing, but it all goes to the same place. And I realized, holy cow, that's my issue. And all these areas that I was touching on in my body, I was just working fascia and muscle. I never thought to myself, I wonder how this is influencing my lymphatic system and my blood flow system. I was not thinking that. Even though, here's the thing, even though I was already influencing them, I didn't realize to what extent, if at all, until I had somebody say, I think I know what your problem is. I think you have a lymphatic system issue. And I went, lymph what? What are you talking about? And they subsequently checked the primary areas of my body where you have lymph nodes that gather, that can swell up. Mm-hmm. And we'll get into that later. Every single one of them hurt just as much as the last one, particularly the ones in my neck. And I kid you not, but within 3 days after that, I felt about 40 to 50% better than I did within the last 3 years. And I'm like, okay, I'm onto something here. Yep. And then that was the ticket where I knew that I was going to go down this road and dedicate my life towards understanding it. And it was right there in front of me the whole time. I just didn't see it yet. And then when you see it and you understand it, you can't unsee it. Yeah. And then now it made sense. I look back, I'm like, oh my God, that makes complete sense. I look at my face and my body, and now that I know what to look for, I look like a big, giant, swollen walking lymph node everywhere. And then I had developed about 3 individual cases of cellulitis. Mm-hmm. Very painful infection of the body. And I'm like, okay, why in the heck am I getting that? You're not supposed to get that, first of all, and you get 3 times? Well, then I realized one of the biggest causes of cellulitis is that you have a lymphatic system that's overburdened and you're living in toxic waste, and then you get an infection. There you go, right? And now when I put those puzzle pieces together and I started to work the system, then the dominoes began to fall. And now I connect that system to all the other systems of the body so people can see. In my viewpoint here, everybody has a lymphatic system issue. They just don't know it yet.
Yeah. It's interesting because My father started off conventional medicine before he got into integrative medicine, and he was an anesthesiologist, and he worked his way up to be chief of pain services. And after all the years of, just doing the drugs, the steroids, the surgeries, he had enough, and he started searching in the 80s and 90s for other things. But he looks back on that time, and people ask, well, what'd you take out of that? And he says, if you know anything about pain, it's not what you put into the body that'll ever treat it. It's what you take out. And that's not surgery. He's saying that was the toxins and the waste that was basically not able to get out. So you could give as much as you want in pills and everything else until you stimulate that lymphatic and especially the organs of elimination. You have a terrible biological terrain that's going to cause inflammation, all sorts of autoimmune disorders and everything else that goes along with that as well. Rheumatoid arthritis, and it goes usually into the connective tissue and around the areas. And then you have inflammation and pain, and people say, why do you have pain? Take painkillers, do this and that, when in reality, you are correct. They should be looking at the lymphatic system and getting rid of things, taking it out of the body. So with that said, and with some of the protocols I know you have and everything, what are some ways that people should be looking at to stimulate their lymphatic system?
Great question. That reminds me of what you were saying there about a quote. I can't remember who said it, but it was a medical doctor who said it. He said, it doesn't matter what your doctor calls it. It always involves toxicity.
Yes, it's true.
In some way, shape, or form, right?
It's the terrain.
So I already know when you have chronic inflammation or an autoimmune disease, your lymphatic system's a hot mess.
Yeah.
It doesn't mean that that's the only issue, but I'm going to contend this. If you don't do something on purpose to try to improve it, you're really going to struggle to get well.
Yes.
Right. So here's the cool thing about the lymphatic system. I think it's the most important system of the body because it controls the terrain that all your cells live in. Right. And you cannot get well in the same environment you became ill within. One of my favorite sayings. So if your cells are living in their own toxic poop, you're going to struggle. Right. So phase number one is try to eliminate that. And you've got about 700 lymph nodes in the body. Some people will say 400, 500, 600. I just want you to know it's like more than 5. Okay. And those are mini toilets, basically. And they act like a toilet to flush waste out of your home. And that's what they do in your body. And they gather in clusters, little communities in the body. Most of your lymphatics live in 3 places. One is the skin, because your skin is exposed to the outside world. And that's why you'll get a lot of skin issues when you have lymphatic issues. For instance, with me, with cellulitis, right? The other one is in the neck. 1/3 of the 600 to 700 lymph nodes are from the collarbone up. So let's just think about the design of that. Why in the world would nature or whatever you believe in put that much there? Because it's probably a super duper uber important region to take care of in relationship to elimination of toxins and ensure blood flow to and away from something that's quite important. That's called your brain.
Mm-hmm.
Right? So people will have neuroinflammation in the brain when they have a lymphatic system issue. And the other one is your gut. By far, the most of the lymphatics are in your gut. Now, why is that? Because most of your immune system lives in your gut. Why? Because it's exposed, the largest surface area of the body exposed to the outside world. It's not your skin, it's your gut. So if I laid out your gut flat out open, it's about the size of a tennis court. Because it has to come in contact with whatever you stick in your mouth, right? So that's why it's a good idea not to put crap food in there if you can, right? But if stuff breaks through that gut lining and you have leaky gut, which most humans do because of it's stress-induced or poor diet or all sorts of different things, then if it breaks through the gut lining, well, then your immune system has to be there to kill whatever breaks through it. And then the lymph system says, I'll do it. And so the lymphatic system automatically gets overactive, right? That's why I go to your gut when I check for anything, all right? So gut issues will cause inflammation anywhere in the body. So now that you know that you've got most of the lymph in the head of the neck and in your gut, and these lymph node clusters also gather around the primary joints of your body. And the reason they do that is this. The two biggest things that keeps your lymphatic system moving, because you want to move that stuff out, is movement. Then people say, what type of movement? And my answer is yes. Just get your body doing something, right? Walking's a great one. Jumping up and down in place is even better. Jump up and down, you'll change your life, right? So movement, because that pumps the lymphatic system through muscular contraction. And because of that, it puts the lymph nodes around the joints of the body that are supposed to move the most. The shoulder joint, the hip joint, the knee joint, and your abdomen. That's why walking stimulates it so well. And the other one is breathing, but a very particular type of breathing. Breathing through your diaphragm, the muscle on the lower part of your thorax here above your abdomen. Many people may be familiar with the diaphragm. And that's a large domed muscle that whenever you breathe in, particularly through your nose, not your mouth, the diaphragm contracts, it pushes your organs down. And then when you exhale, the diaphragm relaxes and the organs get pulled back up. So down and up, down and up, down and up. That sounds a lot like a pump. So what it does is it pumps the lymphatics everywhere because it's pressure. Pressure moves fluids. But where does most of your lymphatic system live? In your gut. So when you breathe through your diaphragm, then you pump the guts. And that's where the largest lymph node in the body sits, about halfway between your navel and the bottom of your sternum. The largest lymph node in the body sits there. And that takes all the lymph from the organs, the pelvis, and the legs and feet right there. If that gets blocked, you're going to have a problem everywhere in all four corners: hands, feet, brain, back, everywhere. Okay? That's why I always have to clear the abdomen first. But if you look at the culture of today, we don't move a lot.
No.
We sit a lot, right? And we don't really walk anymore. And if we do walk, we don't walk with purpose, right? Because I can't walk with purpose, Doc, because I can't see my phone if I walk, and I don't use you're looking down at your phone, so you're locked forward and your posture changes and everything tightens up. And then people don't breathe well. They either over breathe because they're stress breathing. So they're hyper breathers. Or they breathe through an open mouth and not the nose. So you just shut down the two biggest things that move fluid in your body. And then you stack that on top of all of the different toxins that are coming into your body all the time through what you breathe, what goes through the skin, what goes in through your mouth, or what goes in through your thoughts. And then your body is like, I'm doing the best I can with what I got in the moment I'm in, but I'm overloaded here. Like, there's nothing else I can do. And then the only thing it can do is say, I'm going to protect you the best way I can. I'm going to try to kill this stuff for you until you listen to Dr. Perry and you figure out you should work your lymphatic system to flush those toilets, and then I don't have to inflame you so much. Because you always have to just kind of step back and think like your body thinks, right? It doesn't oopsie daisy anything. There's no accidents in the body. And inflammation is on purpose.
Yeah.
So flush your toilets first, and then then the other things will begin to work a lot better. Right? And here's the thing that really sent home for me. I was taking a lot of supplements trying to get myself well. Right? Because a lot of times you need those things because you can't get what the nutrients you need from the food that we eat of today, because I don't even know if people eat food anymore, right? Or it's not just that, it's what was done to the food before it got to you. And depending on where you live in the world, particularly the United States, it's probably something horrific. with the pesticides or the preservatives or all sorts of different things like that. But I thought to myself, you know what? I'm putting these supplements in to help my cells. First of all, can it even get to the cell? Right? If your lymphatic system is overburdened, I'm going to tell you it's not. Mm. And then if it does and the cells use it, well, they're going to make waste from my supplements. So I'm right back where I started from, right? See, the starting place is always the same. Begin to pay more attention to your lymphatic system through that, and hydrating yourself is a big one. Because the lymphatic system, check this out, is 90% water. Mm. And guess what else is? Your blood. So if you're dehydrated, nothing works. Yeah. And most humans are dehydrated.
It's funny because we become kind of this arrogant race that sees our bodies as broken when something goes wrong. Yeah. And it's really our actions, and our bodies are doing the best to make up for our stupidity in our actions, right? It's so much smarter, time. Right? It's so much smarter than we are. We sit there, we go, oh, my body's broken. It must be genetics or something. I need pills for that because I have this, and this. When you want to say your body's so much smarter than you are right now, and you're doing all these things to it it's actually counteracting your stupidity in a sense to help save your life and keep you alive. And here you are talking down to it and giving it chemicals to try and subdue what it's doing to save you. So it's kind of like this really weird thing we have going on right now. We've gone against nature. You're right. We're not walking properly. We're not breathing properly. We're not even drinking. If we do drink water, sometimes it's tap water that's so contaminated, it's probably more toxic than it is helpful. Yeah. We've gone against so many of these things, and then we have this kind of arrogant approach to, conventional medicine will fix it. My body's just screwed up somehow. Woe is me sort of thing. Mm-hmm. Do you find that a lot of people need sort of this retraining when they come to you of understanding that their body is completely not broken? It's actually in an amazing, miraculous, self-healing state right now, and they need to appreciate that. Is education part of this, to kind of re-educate people to realize, hey, we're not broken. That's actually a miraculous thing happening right now that your body's doing to keep you alive.
Yeah, I would say virtually 100% of the time, like 99.999% of the time. Yeah. And it's easy to get to that point, honestly, because I've been there. And you don't want to have suffering and feel that way. And then you start to have a resentment toward your body of, why aren't you working? Why can't you get better? And I'm trying all these different things, right? And it's easy to fall into that quicksand. But that's understandable. But I'll tell you this much. So if you stay in that mindset, you're never going to get well. Yes. Because you just got one foot in the quicksand the whole time. Now that what I call a re-meaning is important, even that one of pain, of what that means. And like we said before, the body always does the best it can with what it's got in the moment it's in to heal and protect you, because things could be way worse than they are, right? It doesn't want you to be suffering any more than you are. But if you're missing some of those fundamentals and basics that we overlook, and listen, sometimes you need medications and medicine, because without it, you're going to be dead, or maybe I'm going to ease your suffering. Like I had cancer 20 years ago, and I removed my thyroid gland. If I don't take my thyroid medication, Perry's going to be lights out. Mm-hmm. So I take that. But it's what I want people to realize is that you can't just do that. Like, add the other things that we were discussing before, so you can lighten the load that your body is trying to carry every single day for you, right? Because maybe, just maybe, you might not need as much of whatever you're taking at some point, or maybe at some point in time, you might not need it at all. I don't know. But I do know this much, that if you have this overloaded lymphatic system and the ability to get rid of that metabolic cellular waste, you're always going to struggle. But it's how you frame it too. So, but also people don't know what they don't know. I've been in healthcare most of my life, and I wasn't paying attention to the lymphatic system. So I can't fault somebody else for not knowing about it. And I was actually quite angry in the beginning because I was seeing multiple doctors and multiple specialists that went through surgery. Not a single freaking one of them ever said the word lymphatic system to me, right? So it's just a matter of like, once you see it, you can't unsee it. And one of the easiest ways that I try to get people to learn about the lymphatics is an analogy. If I may give you this,
Please.
Because I said, okay, if it's a new concept for people, the easiest way for them to learn it is to equate it to something else that they already understand, and then it makes sense. So there's two ways that I explain it. One, I've already given you of the lymph nodes basically being mini toilets like you flush in your house. And the toilets go from there down a pipe into a bigger pipe and out to a bigger pipe. And that's the way the lymphatic system works, from small pipes to medium pipes to bigger pipes to exit out. So you have to clear all the pipes. And if you get a backed up toilet in your house, I don't want to be anywhere near your house. And it's the same thing with your body. But my favorite one is the fish tank analogy. So my program is called Body Aquarium Lymphatic Mojo. Mojo just means magic. And I mean the magic of how the body can heal itself. So you think about the fish tank. It's water in there, right? Well, you're mostly water. Okay. And inside that tank, you've got your trillions of different cells with all these different names that humans gave them different names, but they all pretty much function the same way. Well, those are fish. Imagine having a trillion fish in that tank, right? So what you have in the tank is you feed the fish, you give them food, right? That's the nutrients in there. But you also have this little filter system up in the corner that has these little bubbles going in there. And then that's going to keep the water moving. And that gives it what? Oxygen, right? So they got nutrients and oxygen. And the water, if you take care of the tank, looks awesome, right? But what keeps that tank looking so great are all those things underneath the tank that you don't see because they're hidden by the cabinet. And those are the pipes and the filters, and that's the lymphatic system. Right? So if that filter system went kaputs, you wouldn't notice it right away. But in a couple of days, you would see that water doesn't look so good, right? It's going to start to turn green or mucky, and then things start growing on the glass, and you can call that biofilm, because and then oxygen starts to go down because the water becomes stagnant because it's not moving. And then when you have low oxygen in the body, you're going to have pain somewhere, period. And the things that want to kill you love low oxygen: bacteria, virus, cancer cells. That's a beach day for those guys. Then stuff starts to grow on the fish, right? And then eventually you'll look at the fish and you'll see them struggling to breathe like this. That's your cells. They can't get the oxygen in. And you can keep feeding those fish, but if you keep feeding the fish are going to keep pooping, and they're living in their own poop and the food at the same time. And they're going to die, right? And that's what happens to your cells, because nothing wants to survive in that water. So then I asked for people, said, how in the world would you fix that problem? What would you do? Well, you have to take everything out of the tank, and you need to clean the tank, and then you put new water in there, and you put new fish in there, right? That's kind of what we do in medicine right now, is that we just take care of what we see. And then, but if that's all you did, what would happen a week later? Same thing. Holy cow, they're dying again. It looks terrible. And then I say, well, what's the biggest thing that you forgot to do? I got to look underneath where nobody's looking. I got to clean your pipes out. Because then if you can get that, then you do the other step. Now stuff lasts. So here's the message I'm trying to send home for you. What you do first, and you always do first, is clean your filters first. Clean your lymph first. Then you go back and you do all the other stuff. And that's what I see people doing all the time is they're doing all the great breathing techniques. They're doing all the diets, all the supplements, everything they're supposed to do. But nobody ever showed them what to do with the lymphatic system. So here's the next caveat. People say, Doc, but guess what? I'm breathing all the time. I took all the courses and I move all the time. Shouldn't my lymphatic system be super good? Well, the operative word is should. Sometimes that's not enough. Why? Because they're too overloaded, too overburdened, full of too much muck that you can't do that. So for instance, that's the toilet that the only way you're going to get it to unclog is to plunge it or snake it. That's it. If you keep flushing it, it's going to overflow. Well, that's what your hands are for. That's when you do lymphatic resets, lymphatic massages. Mm-hmm. My favorite way is by hand, right? But you can do any technique you want as long as you do it in the right order, because that's really important. Hopefully you have time to discuss that, because you can't just start pressing on body parts and move your lymph and cross your fingers and hope everything works out. There's a certain way that you need to do it based on how pressure moves in the body and how fluids move in the body. If not, you're going to make yourself way worse. Then once you understand that, you can put the puzzle piece together of anything in relationship to where you want to get blood flow in, where you want to get blood flow out, and how you get lymph flow in. Because here's the dirty little secret, and then I'm going to stop talking for a second. All the systems in the body work together. They never work alone. They never get injured alone. So when I work on these areas, I always influence blood flow in, blood flow out, lymph flow, and nerves, always. So when people say, Doc, when you do these resets, which system are you impacting? My answer is yes. I just want you to do it in the order that I'm going to show it to you in, because that's going to be the biggest difference for you.
Right. There is no one system without the others. So you can't say that one system is only being impacted. It's impacted all of them. And the lymph system, of course, has such an impact on others, and everything is interrelated, and it's going to be a little bit different. If your lymph system isn't working, it can impact a different organ. Maybe your heart's more impacted for you, or maybe it's the liver, or maybe it's the endocrine. Who knows, right? Everyone has their predispositions, but we do know you're in a shitty aquarium. Let's put it that way. So you have to change that. Now, you say the importance, the priority is a critical factor in this. So let's go into that, because I think some people just say, just drain, just, do whatever you do. And that can go with even dry brushing I've seen. And, experts will say, no, there's not any size fits all. You have to do it in certain ways. The body works in that way as well. So what is the significance of the steps within this that you'd recommend for lymphatic drainage?
Yeah, that's a great question. So doing dry brushing and breathing and movement is great. At least you're doing something for the body, right? But once you understand how fluids move in the body, it changes everything, right? That's the biggest thing that I try to teach people. And that's based on the law of hydrodynamics. So I'm going to go a little bit of kind of the physics of how fluids move, one of the biggest properties of fluid. And it's this. Okay. High pressure fluids like to flow to low pressure fluids. That's just energy efficiency. Like high naturally goes to low because it's the easiest thing to do. Okay? So imagine that you've got a water dam. Okay. And then the water dam, you've got everything on one side and you've got nothing on the other side. If you open up the doorway for the dam, the water naturally goes to the low side, right? That's the way the lymphatic system works. So the lymphatic system goes from high pressure to low pressure. So where's the lowest pressure in the body in relationship to fluid flow? It's lowest pressure for lymph flow, and it's the lowest pressure for vein flow. And that's cool because the lymph flows into the veins at the lowest pressure site. The lowest pressure site in the body for fluid flow is the collarbone, both sides, right? Everything wants to go there. Now, if that's the lowest point, Let's extrapolate out where the highest pressure points would be. The furthest distance away from the collarbone.
Mhm.
Your fingers, your feet, and your head. That's why the fingers get swollen, the hands get swollen, in particular, the feet get swollen, because then you have to fight more gravity going all the way up, right? And it's trying to get there. That's what I'm telling you. It's trying to get to the low pressure side. But in order to get to that low pressure, it has to get past those lymph node clusters that we mentioned before. Now, if you have some type of obstruction or some type of blockage at your exit point where everything flows to, you're going to have an increase in pressure at the collarbone because it all can't flow out. Imagine a big pipe that has fluid in it, and I constrict the pipe 50%. Well, the fluid's got to go somewhere. If it can't go out, where does it go? It goes backwards. So when you close the collarbone down, and that happens a lot from tightness or tension and poor posture and poor breathing, all those sorts of things, then you backflow pressure to the furthest points. You get it in your brain, you get it in your feet, and everywhere else. And then they become stagnant because they can't get out, right? So when you do lymphatics, many people start dry brushing from the hands and the feet. And I don't want you to do that, because if you do that, you're bringing stuff from high pressure towards low pressure that might have blocks in it where it can't get out. So if you're blocked at the collarbone and you're sending stuff to it from your feet, well, it's just going to swell up because it can't get out. So you always go from low pressure towards high pressure. And in my world, it means this. You start from the collarbone with your work and you move up to the top of the head. You start from the collarbone and move down to your hands and then down to your feet. Once you do that, then you can work your way from feet and hands and head down. But you always go low to high first before you go from high to low, because it's just based on how fluids work. So remember, I told you before about the clusters, right?
Mm-hmm.
So let's give you an example. Let's say you've got swelling and inflammation in your right foot, or I've injured my right foot and I've got damage there because I sprained it. Well, you have what? Inflammation. Well, that's going to be your immune system. That's going to be lymphatics, right? So anything that's in that ankle that's been damaged, your body's going to try to get it out. And where's it got to send it? To your collarbone. That's where it's got to go, right? Particularly to the left side of your collarbone. That's where most of the lymphatics drain. But in order to get from your right foot to your collarbone, it's got to get past the lymph nodes in your right knee, the lymph nodes in your groin, the lymph nodes in your abdomen, and along your spine before it dumps into the left side of your neck. But that's just one pathway. Now, in order to heal that ankle, I need to get blood flow and nutrients and oxygen to the ankle. And then I'm going to ask you, where does that come from? Well, that comes from your heart, right? And then now the heart's got to send it down to the foot. But if you're blocked in the knee and the groin, in the abdomen, and in the collarbone, it can't even get there either because you're blocked both ways. So what that means in my world is you never treat the ankle first. Why? Because if stuff can't get out that I'm trying to treat it, and I'm trying to bring stuff to it, my supply chain may be broken. So what we do is I always drain from the collarbone down to the ankle, then I treat the ankle. Does that make sense? Because that's a whole different ball game right there, right? Because now I want to ensure that my pipes work both ways. And because those nerves that sit there, nerves don't work well, and they don't like it when they can't breathe and when they can't get oxygen and they can't get rid of the waste that they make from wiring and firing. So they're also the fish that sit in the toxic tank that you can irritate, right? But the only way you're going to know if those areas are blocked is to check them. And here's the cool thing. When you check them, you automatically clear them. How cool is that?
Yeah.
Right? And then along the way, I'm looking at your reaction to what I'm touching and what I'm clearing. Because I can promise you this: if I touch you in the abdomen and you jump off the table, or you want to punch me in the face because it hurts when I push into your abdomen, I'm going to tell you that's going to be a deciding factor on whether your ankle gets better or not. Because that's where the choke point is for everything to and from your ankle.
Right.
Because your body automatically knows what it needs to do to heal itself. The question is, are you giving it the supplies it needs to do so, yes or no? And if your blood flow is compromised in or out and your lymph flow is compromised, I'm going to tell you it can't. And that's why stress is so important, because stress, incessant stress, increases tension in the body. And tension is tightness. And tight tissue doesn't accept fluid flow well. If you want to know what that feels like, make a fist for 5 minutes and let me know how your hand feels. Right? That's the same thing that's happening in all these areas, from tension and stress, from your job, from your relationship, from your forward posture, for how you think about yourself, all the stuff, 24/7, bam, 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 bam. Right? And then it can only take so much. And then when the body can't do it anymore, it tells you. It says, I need your help. I need you to change something. And what's the catalyst for change? I'm going to hurt you, is what I'm going to do. I'm going to cause pain. Not to punish you, but I'm trying to help you. And the biggest lesson I'm trying to teach you is, please don't look only at the site I'm sending you pain at. That's what it's trying to tell you. That's why you clear these lymph node channels first when I work with people, no matter what. Like, everybody clears these lymph channels no matter what your diagnosis is, because of, like I said before, with toxicity. Then we go back and we do all the other stuff. That's my number one benchmark of lymph comes first always. That's why. Does that make sense? That's a big concept that I want people to understand of. It's not just what you're doing. It's where you're doing it, and the order that you're doing it in will make the difference on your results.
Yeah. I mean, it absolutely makes sense, especially for someone, I have a business background, understand economics pretty well, and supply chain management means so much. If you can't get something to somewhere, it doesn't matter. The demand doesn't really rush it. If you don't have it, it just simply won't work. So in this case, if you have pain and inflammation somewhere, which is a wonderful teacher of everything, but you cannot literally get the waste out, bring the oxygen nutrients in for the proper, you're in a losing game. So the whole idea is very, it's simplistic on the essence of it, in a sense, because we all need to be moving things throughout the body, and the lymphatic system is that highway that does it. That seems to be, like Los Angeles on, during rush hour a lot of times in most of us.
Yeah.
And we are living in quite dirty aquariums.
Oh, everybody. Yeah. So it's not, I'm not saying that that's the only problem. And when you fix that, it's unicorns and rainbows. Sometimes it is. But what I am going to contend to you, it is such a big piece of your fundamental puzzle that if it's an issue and you don't take care of it, all the other things that you're doing, one, might not work, or here's the proverbial problem that everybody ends up with. Everything keeps coming back. That's something I've always wanted to know. Why in the heck am I doing all this stuff and stuff keeps coming back? Now, you're allowed to have more than one problem, but that one that I told you about, blood flow in and blood flow out and waste out, that's simple, but that's so fundamental that if it's not working right, you can't heal, period. Because that's the only way your cells get anything, man, is from blood flow. How the hell do you think it gets there? So it goes into the blood, but then it leaks from the blood and goes into what? The fish tank. And it goes into the fluid to get to the fish, to the cell. And then it goes back out. So it's the in and the out supply chain. Yeah. So it's not just a matter of blood flow getting to the fluid, but will the fluid allow it to cross over to get to the fish or not? And if your lymphatic system is toxic and you're full of waste and you're full of excess protein because you can't break it down because you got a leaky gut, well, then you're not. Right? Yep. So you do this in conjunction with everything else. This is what I'm trying to tell people is do what you're already doing, but now add this to it. And then I want you to strap yourself in and watch what happens next. That's what I'm trying to tell you. Because when I show you how to release these places, people say the first thing they tell me is, Doc, there's no way. Are you kidding me? That's it? That's all you got? It can't be that simple. And then I tell people, well, who the hell ever told you that? Why can't it be that simple? Effective things don't have to be complicated, right?
That's right.
It's just supply chain logistics 101.
Yeah.
Right?
Here's
the thing that happens. Yeah. When I did my lymphatic system, I got rid of 30 pounds of swelling and inflammation and body fat in 1 month. Because I got rid of the muck. Because when you're full of muck, which is my technical term for it, your body swells your container to try to dilute the muck. So you hold on to body fat, you hold on to swelling, inflammation, and edema, and you're like this, and you can't get rid of it. Right?
Yeah, I mean, there is so much I would love to keep talking about this subject because it is such an essential one. And we could go on for hours. I know we could, but yeah. I do want to start to wrap things up a little bit here. And listen, you have an incredible Instagram. You share so many things and you do break things down into simplicity in these analogies. But for those that are listening, what do you find is one of the most important things that you could implement in everyday life to help become better, stronger, more flexible, and just more healthy overall?
That's a great question. Well, I'm always about basics and fundamentals. One is to hydrate yourself, which means drink more water than you're doing right now, right? And try to make a good quality water. And then watch whatever else you're sticking in your mouth in relationship to the water, which means not 2 cups of water, 5 cups of coffee, right? Minerals and electrolytes are a huge deal that I tell people to look into because stress depletes minerals, and then most people don't absorb plain water, so they need some type of cell salt or electrolytes so they can get rehydrated. And then when you do that, you'll very often find that your sleep improves. And then I tell people, try to get more sleep, because if you're not sleeping, nothing works, right? And then get more movement in your life, but different types of movement. So one is, I tell people, just simply stand up and jump up and down in place for 60 seconds to 2 minutes as you breathe in and out through your nose. And you can change your life quick, fast, and in a hurry just from doing that, right? Because what are you moving when you do that? Yes, like everything. All your fluids moving up and down. Your organs are moving up and down, right? It's a huge deal for that. And then another one is, I'm going to tell you to try to surround yourself with more positive people in your life and not so much toxicity, because that's the one, that can suck your healing energy out of you without you even realizing it. So take note of who you're surrounding yourself with during the day, in person, but also where you choose to surf on the internet. Yeah. And then look in the mirror, because the most toxic person might be you. Right?
It's very
those are some simple, profound ones like that. Those are catalysts for everything else. And then, of course, like we mentioned before, is begin to work your lymphatic system.
Yeah,
that's a big one.
No, those are profound, fundamental lessons we all have to take in. And I even posted on this one recently. Say I love you more. Most importantly, to the person in the mirror. I think we do kind of have a toxic relationship with ourselves. And, toxicity isn't just in that physical format that accumulates from the glyphosate, everything else. It's the emotional toxicity. You said the people, the energies that are toxic that can be so impactful. And we often forget about those. Dr. Nickelston, I want to wrap this up and allow you to kind of share where can people learn more about you. I think you have a book coming out, right? Stop Chasing Pain, and so many other things I'm sure you're working on.
Yes, thank you very much. I appreciate that. Yeah, the book is is coming out hopefully within the next year or so. A work in progress for sure. But you can go to my website, stopchasingpain.com, and then that'll be the jump start for all the things that we offer people. And we're on every social media platform you can think of, and we have education for all humans, not just healthcare professionals, but everyday people that you can. There's so much to choose from. It's a rabbit hole that you can definitely go down and learn a lot. And we also have our own podcast that we've had on the air for over 12 years. So we were one of the first ones to come on out, and we've talked to a lot of smart people over the years. And it'd be cool if you tune into that. It's called the Stop Chasing Pain podcast. Imagine that. But thank you so much for having me on. I had a really good time.
Oh, this was amazing. Thank you so much for your work, and wishing you all the best. And everyone, please do go check it out. StopChasingPain.com. Dr. Nickelston, thank you so much. And as you've heard here today, aging is inevitable, but pain doesn't have to be. Check out Dr. Nickelston's website for countless resources for improving strength, flexibility, and resiliency. Until next time, continue writing your own healing story.